Namaste. My name is Pankaj Savadekar. I wish you all a very, very good afternoon and welcome you to this webinar with Dr. Shruti on how to detect, diagnose and cure cancer. My name is Pankaj Savadekar and I represent a team of care managers from MedicoExperts. MedicoExperts is a virtual global hospital headquartered in India. Is established to offer quality healthcare services at affordable pricing without compromising the success rate of the treatment. We have our presence in over 17 countries across the globe and have more than 1,500 super specialist doctors and 300 multi-specialist hospitals on our panel. This webinar in particular has been conducted in collaboration with our very dear partners and colleagues from Mainstay Healthcare Development Foundation, headquartered in Abuja, Nigeria. Mainstay Healthcare Development Foundation is doing some amazing work at collating forces of the general physicians from across the country, that's Nigeria, to empower them to provide efficient medical services to their patients. Without taking much time, I think I should invite Paul Hassan Elegbusi, the program manager from Mainstay Healthcare Development, to introduce the services of the foundations in brief. Paul? Mr. Paul?
Thank you very much.
Can you please switch on the camera?
Yes, I am Paul Hassan Ilegusi, the program manager of Mainstay Healthcare Development Foundation, headquartered in Abuja here. And we have in our midst DOT chairman in person of Honorable Yishuku Isikaku is here with us. We have some of our members too. Dr. Nasai Ishaku, Dr. Rotimi Ayodele, and some of us are here too. And Mainstay Healthcare Development Foundation, just as MedicoExperts have said, we were registered last year with Corporate Affairs Commission, and we have our objectives towards implementing primary health care, sustaining primary health care components in all the private health sectors, as well as the government health sectors. Then we have our objectives towards promoting healthy aging among the elderly ones. Then we promote school health services in Nigeria. Then we also showcase the protection of traders in their workplaces, and many other things that we do. And another thing, in the promotion of academic scholarly work, we also engage in the publication of African Journal of Primary Health Care. And it's a pleasure meeting with MedicoExperts, because we know that in the virtually every month we'll be having this webinar, so that all of us will be on ground in ensuring that debilitating diseases are taken care of in collaboration with our organization. And I want to believe that today's training, all of us, we are going to gain tremendously. And if you have any questions, please put it in the chat box. I know that our facilitator today will do justice to that. Thank you very much. Over to you.
Paul, for your introduction, I really appreciate it, for keeping it crisp. And now I would like to introduce Dr. Shruti Kate, who we have all assembled here to listen to. Dr. Shruti Kate is a reputed medical oncologist having 14 plus years of experience. She completed her bachelor's in medicine and surgery at Lady Hardinge's Medical College, a very reputed medical college from New Delhi, the capital of India. And she also completed her master's in internal medicines at Maulana Azad Medical College, again in Delhi. And she did DM in medical oncology at Tata Memorial Hospital. Currently, she is a head of medical oncology at the HCG Manavata Cancer Center in Nasik, which is very near to Mumbai. Dr. Shruti Kate is a highly skilled and experienced medical oncologist with a deep understanding of various cancer types, treatment options. She is known for her compassionate and empathetic approach towards her patients, providing them with much needed emotional support during their cancer journey. Not taking more time, I'd request Dr. Shruti Kate to start with the presentation on how to detect, diagnose, and cure cancer. After her presentation, we are going to take your questions, requesting Dr. Kate to answer. So while she is doing the presentation, in the meanwhile, you can type your questions in the chat box and concerns so that we can ask questions to Dr. Kate on your behalf after the presentation. Dr. Kate, may I request you to please start with your presentation. Thank you.
Thank you so much, Pankaj-ji, team of MedicoExperts, also Mr. Paul and his foundation. I want to thank you all for gathering and inviting us for talking with you, and we would like to present something for you. So it's really wonderful to be a part of this meeting where there'll be sharing of knowledge, and I hope it happens from both the ends. I am really very thankful to Pankaj for his kind words and introduction. So I would like to share my screen. We would have a short presentation. Yeah. Just go back to the first slide. Yes. So why we have chosen to talk with you all today on cancer and how to prevent and detect it early is because you all know as physicians that the incidence and prevalence of cancer is rising worldwide. Unfortunately, in developing countries, cancer is the leading cause of death now, and still most of the cancers are caused by infections like human papilloma virus, hepatitis virus, and 30% of the cancers in lower and middle income countries are due to cancer causing infections. So the most common cancers we know in women is breast cancer. In men, it is lung and colon cancer, and subsequently it is the cancer of the intestines and prostate gland. Tobacco consumption in any form is the most common preventable cause of cancer. It's an understatement because we know that tobacco harms our body in many, many ways, and cancer is one of its ill effects. There are other causes of cancer and also the factors which increase the deaths due to cancer, and we will be talking to you about that. Full screen. Okay. Yeah, so I think it is better visible now. Okay. So the key message today is to know that many cancers can be cured if they are detected early and they are treated effectively. Since cancer develops over many years, especially in case of cervical cancer and prostate cancer, there are precursor lesions which can be identified, and hence the role of screening comes. Preventable causes of cancer eliminate the precursor lesions and enables us to stay free of cancer. So what is cancer? Cancer is basically a division of cells of our body which get transformed and grow in an immortalized way. The cells, they do not die, they continuously divide, and once they divide in a fashion which is not in control of the body, they start forming masses in the body, and then they start spreading to other organs. So cancer is basically the cell of the organ of its origin, which is the patient's own cell. And then it gets metamorphized into a cell that is not in the control of the body. So this is the basic principle of how cancer develops, and since it's body's own, body's immunity is able to evade cancer at some level. And hence comes the role of immunotherapy in the treatment of advanced cancers. For any cancer, there are certain non-modifiable risk factors and there are certain modifiable risk factors. Our age, which is continuously increasing, is a non-modifiable risk factor. Our genetic makeup, our hereditary, our DNA, which we get from our parents, is also a non-modifiable risk factor of cancer. The third non-modifiable risk factor is our sex. So by virtue of being a lady who is 38-year-old, I am bound to develop breast cancer irrespective of any other risk factors that I have. So every person on this earth can get cancer. So we hence have to ensure that we incorporate screening tests for all of our patients who have a baseline risk of cancer. But then there are certain other patients or human beings who have slightly higher chance of developing cancer. Here comes the role of modifiable risk factors of cancer. There are certain dietary factors like low consumption of fruits and vegetables or fiber, increased consumption of red meat or smoked products. Addictions like tobacco, excess of alcohol also has been related with breast cancer, colon cancer, pancreatic cancer. Our weight is also a modifiable risk factor. So less physical activity, being overweight or obese is a modifiable risk factor of cancer. Then infections like hepatitis B virus, human papilloma virus, H. pylori virus, HIV, Epstein-Barr virus, and HTLV. These are all viruses which can cause cancers. Less pertinent to us is the environmental factors, because most of the time they are not known. So except when they are in very high dosage, like ionizing radiation for someone who has taken treatment of cancer can develop cancer due to the radiation after many years. That happens in small children who received radiation for lymphomas, and later on they get breast cancer when they grow old. So UV rays, harmful chemicals in the dyes or paint industry are also certain risk factors for cancer. Then our hereditary is directly linked with certain cancers like breast cancer, eye retinoblastoma, which develops in the eye, colorectal cancer, which is the cancer of the intestine, and blood cancers like leukemias. So, like I said, it cannot be overemphasized here at this forum, but addiction of tobacco in any form is very injurious to our health. At the same time, even alcohol consumption, a daily alcohol consumption of more than 10 grams is actually linked with development of very many cancers in our body. These are certain other cancers which can be caused due to tobacco. Most commonly, it causes the cancers of the head and neck region, the mouth, tongue, the buccal mucosa. Then the inhaled smoke of cigarette smoking can cause lung cancer, food pipe cancer, the esophageal cancer, bladder cancer, urinary bladder cancer, and also the cancer of the stomach. Being overweight has been linked with uterine cancers in women, postmenopausal breast cancers, and the cancers of the intestine. It is very essential that we incorporate healthy lifestyle in our patients, which includes a balanced diet as well as daily exercise and maintain our weight in the normal BMI range. Like I said, these are the viruses and microorganisms which can cause cancer, and it is notable that now the incidence of virus related cancers is coming down because of the pickup of vaccination for hepatitis B and C, and also for the human papilloma virus. Again, I would encourage all physicians to incorporate vaccination strategies for all your patients, and especially for girls in the age of 9 to 14. We should vaccinate them with HPV vaccine, which is available, Gardasil vaccine. 2 doses are required for girls less than 14 years of age, and 3 doses are required after 14 years of age. But mind you, these vaccines will be only effective before the sexual debut. So before the girl is sexually active, if she receives 2 doses of HPV vaccine, if she is less than 14 years, then she will be free of human papilloma virus infection that leads to cervical cancer. Because cancers can happen to anyone, irrespective of the risk factors, it is important that we know what the warning signs of cancer are. So any lump in the body, any painless lump in the breast or axilla, any postmenopausal or postcoital or intermenstrual bleeding. So any abnormal menstrual bleeding in women should always be investigated, because it is a very specific symptom for cervical and uterine cancers. Any difficulty in eating, which is called dysphagia, or any bleeding from the rectum, intestine, or in the cuff is also a warning sign of cancer, where the person should be investigated for the reason of this abnormal symptom. Again, any significant weight loss should always be investigated, because many times lymphomas could be there which do not have, or leukemias could be there which do not have very specific symptoms, but weight loss can point to an investigation or a whole body investigation where the underlying cancer can be picked up. So it is my duty to highlight that cancer team is a group of doctors, and the most important person here is the family physician. And in your case, I would say that you all are the most important key person where the diagnosis of cancer begins, because you are the person where the patient immediately reports to with any abnormal signs and symptom which leads to the diagnosis of cancer. So the family physician, followed by the pathologist who identifies the abnormality in the biopsy. If we look at our tumor board, it is comprised of a medical oncologist like me who gives chemotherapy, then a surgical oncologist who performs surgeries, and radiation oncologist who kills the tumor with the X-rays or the radiation devices. Are the key members who take part in the treatment of the cancer. We are all supported by our psycho-oncologist, our physiotherapist, our social workers, our blood bank team, and of course the family members and the friends of patients, because this is a very crucial time of the patient's life where there are a lot of ups and downs happening every day, and we require the support of immediate family members to give or deliver the best treatment that we can offer. So whenever we want to diagnose the cancer early, it is not a single step. It includes three things. First is the clinical suspicion. So if there is any red flag symptom in any particular person, it has to be immediately reported. That is how the diagnosis will happen early. Then if suppose we do not have any signs and symptoms, can we still diagnose cancer? Answer is yes, we can diagnose certain cancers even before they produce any signs and symptoms. These tests are called the screening tests. Then third thing is referral to the expert. Unfortunately, even today in the developing part of the world, many times there is a suspicion of cancer, but still the diagnosis is delayed because the expert facilities are not available to complete the diagnostic workup or to start the treatment. So I would say that it is very important to immediately refer such patients for the further workup and diagnosis, which leads to the treatment of the cancer, and hence we can save the life of the patient. So when we come to the diagnosis of cancer, this starts with very basic tests like blood tests, urine examinations, X-ray, and certain specific tests like mammography, tumor markers, and most of the times we require a biopsy of the patient if it is not a blood-related cancer. And for the staging of cancer, where we want to see where all the cancer has been spread or where all it is restricted, a PET CT scan is required to have a proper staging of the patient. So it is very important that all these things are available in one center so that the diagnosis happens fast. As a person who has worked in many hospitals, I would say that this is also a key place where the diagnosis is delayed many times, because the patient may be referred from one center to the other for a specific test. So fortunately, the place where I'm working now, we have all the facilities, right from conducting the tumor markers to advanced molecular tests to PET scan. We have all the facility to conduct all diagnostic workup at the shortest duration of time. So like I said, these are the treatment options that are available for the patient. And now it is the age of precision medicine, where we do not use all treatment modalities for all patients. But yes, for many patients, multidisciplinary approach is required, where we combine one or two or three modalities of treatment after discussion in a multidisciplinary team. So whenever a new patient of cancer is diagnosed, we conduct a MDT meeting, which is a multidisciplinary team meeting, which is comprised by a surgeon, a medical oncologist like myself, a radiation oncologist to help us. There is a radiologist and a pathologist. And then we decide whether the patient needs to go for chemotherapy first or surgery first, or the patient needs chemo and radiation first. So these things are very important because it helps the treating doctors to know what is the flow of events, and it also lets the patient know what is going to happen next with him or her. In this case, when this is conducted in a very structured way, we are able to avoid patients from opting out of treatment due to ignorance or something, and it also ensures that the treatment is completed on time and the default rates are low. There is a new modality of treatment that has come up, which is immunotherapy, which is for advanced cancers, where it increases the immunity of the body, and the body's immune cells, they target the cancer cells, and the patient's life is increased. So now we are moving ahead in an era of where less is more. So initially the surgeries used to be called better surgeries or nicer surgeries when the stitches used to be more, or the stitch line used to be more. So bigger the surgery, better it is, was the philosophy some years back. But now we live in an age where we want to give a minimally invasive surgery to the patient. So the scar is very small. And if you look at this photograph, this is a surgeon which is operating on the patient by the means of a robot. So this is a robotic surgery happening where there is. Okay, so this robot surgeon who is operating is sitting on a screen and operating on a patient who is on the table. So here you can see that the person is handling devices in the hand, and directly the robot is operating. What the functions it to be more effective is that the range of motion of the devices that are held in the surgeon's hands are not restricted by the restriction of joints. So there is a 360-degree motion that is possible if the surgeon is operating through a robot. So what it does is that it enables a better view of dissection. It also ensures that the scars are smaller. It also ensures that the post-op recovery is faster, and it also ensures that the patient has very less post-operative pain. So robotic surgery is also the talk of the town now, and I am very proud to say that our surgeon, Dr. Nagarkar, has conducted almost close to 1,000 robotic surgeries, and which is a record in itself. So just to highlight what new has come up in the field of cancer treatment. So like I said, cancer treatment cannot be done in isolation, and it has to be a comprehensive cancer care where the team of doctors works in collaboration with each other. So whenever there is a cancer which is very localized to one part of the body, a simple surgery or a radical surgery could be used to control the tumor, and depending on what the pathological risk factors are, some additional treatment like chemotherapy or radiotherapy may be required. There are certain in situ carcinomas which are pre-malignant conditions where very minimal small surgeries are required, and certain treatment, certain restrictions of diet and all can also prevent these pre-malignant conditions from changing into cancer. Coming to the role of chemotherapy, this is one field where there is every hour there's a new molecule which is being discovered. So there are very many chemotherapy agents which are available, very many ways in which chemotherapy can be delivered now, and usually the patient requires chemotherapy either before the surgery or after the surgery, and when the cancer is spread, the patient may require only chemotherapy. So this was a few years back when we were restricted to only chemotherapy for the systemic treatment of cancer. But now we live in an age where we have targeted therapies available, we have immunotherapies available, and we have various modalities in which chemotherapy can be given in a way that the side effects are minimum. So it can be either an oral treatment or it can be an intravenous treatment. To prevent chemotherapy-induced hair loss, we have the scalp cooling system also available in our hospital, where with certain protocols, if scalp cooling is used, the hair loss is prevented by 60 to 70%. So I had published this paper of our experience of using scalp cooling system to prevent chemotherapy-induced hair loss in our 100 first patients that we took on the Paxman scalp cooling machine. Radiotherapy is an advanced way of treating the cancer cells. It is done by the help of X-rays or gamma rays, which penetrate the cells, and it basically delivers a maximum dose to the tumor cells. And with the newest of the radiation machines, we can now minimize the radiation that is delivered to the surrounding normal tissues, so that we have less of radiation induced side effects. So this is how the radiation is delivered to the patient. There is either a teletherapy where the entire part is exposed, or there is brachytherapy where only a specific part of the body is subjected to high dose of radiation with the use of needles and radioactive material. So prevention is always better than cure. I will again insist on following a diet which is balanced, which is preservative free, which is low in saturated fats, as well as processed meats and smoked food. All these things do have an implication in causing carcinogenic changes in our body. It is important that we incorporate fresh fruits and vegetables daily in our diet, and it is also very important to incorporate healthy eating habits in our children, because now we see that the times are changing and our children are getting exposed to unhealthy lifestyle in a very young age. Childhood obesity is more dangerous than adult obesity. Children who are obese tend to develop very many diseases like high blood pressure, diabetes when they grow up, and also development of cancer. It is important to eat legumes as well as whole grains rather than processed foods. Alcohol moderation is important. Absolutely no to nicotine in any form is absolutely essential. So what we should not do is, we should not become couch potatoes. We should not just engross ourselves in work. It is important that we ensure that we daily exercise, do some meditation or yoga therapy to de-stress ourselves, because there are certain causes of cancer which are not yet known, and stress could be one of them. So what we need is to incorporate a healthy life where we are more relaxed and follow that daily. So like I mentioned, hepatitis B vaccine is now available. Human papilloma virus vaccine, Gardasil vaccine, is for prevention of cervical cancer. I encourage you all to give this vaccine to your daughters, to all your patients. This vaccine is also available now across the world. So cancer is curable if it is detected early. It is very important to know that, because many times due to the fear of cancer, patients defer the tests which are required for diagnosis, and it results in increase in their cancer, and then the chances of cure also become less. So early diagnosis, how is it possible? It is possible when we all know of the warning symptoms of cancer, which is through health education, through all of you physicians who are well read, well educated. You know what to tell your patients and how to read the red flag signs, symptoms of cancer. Physical examination, whenever there is any doubt, should be done by a specialist. Screening tests should be done for early detection of cancer.
How are you?
For breast self-examination, we should all teach our patients how to do the breast self-examination, so that any lump, if it is developed, the lady can report immediately. It is also important to know that any lump in the breast can be cancer. Any lump in the axilla can be cancer. It does not depend on the age of the patient. Now we are seeing that there is an increase in breast cancer in younger women, as young as 21-year-old, 22-year-old. I am currently treating 3 patients who are less than 25-year-old, who are not even married or have started their family. So age is not a criteria of ruling out breast cancer. So this is an important takeaway message that I want to give to you all. Any painless lump in the breast or axilla has to be evaluated irrespective of the age of the patient. So when we do the screening test, some are the general examinations, then we do the oral cavity examination, we do the lymph node examination, we do the breast examination. Then for women, we have the pap smear examination for diagnosis of cervical cancer, and we have the mammography examination for the detection of very early breast cancers. For males, it is very important that after the age of 60, we subject our parents, our in-laws, our patients who are above the age of 60 to a PSA test, which is a tumor marker test, where we can identify a very early prostate cancer, which is not even causing any symptoms. So what happens is that when in a prostate gland there is a tumor, unless and until it grows to a very big size, the urinary symptoms will not come. So only when there is pressure on the urinary bladder, urinary symptoms will come. So if there is a very small tumor, the patient will not have any symptom. But if we do a tumor marker test, PSA test, we can see that the level is high, and we can investigate for development of for any occurrence of breast cancer. So this is my hospital, and I thank you all once again from my behalf and my entire team of doctors from HCG Manavata Cancer Center in Nasik for listening to this talk and inviting me here once again. Thank you.
Thank you, Dr. Shruti Kate, for a very educative presentation. Really appreciate that. We could understand a lot about detection and diagnosis of cancer from the presentation. Thanks a lot for a lovely presentation. Now, before we start with the questions, friends, there is we would like to invite Mr. Dheeraj Sharma, who is the CEO and director of our organization, MedicoExperts, to introduce the services provided by MedicoExperts. Mr. Dheeraj Sharma, sir.
Good afternoon, everybody. And thank you, Dr. Kate, for a wonderful presentation. And it was really very informative. And I would like to create an opportunity for you to take a small break till the point I'm can have a cup of coffee or tea in the meantime. And we will come to the question and answer sessions. So guys, I'm here to talk something about MedicoExperts, what MedicoExpert is doing, and particularly for Nigeria. So all my doc friends and the Mainstay Healthcare Development Foundation, we have taken an initiative to ensure that we are able to increase the capabilities and capacities of Nigerian doctors. And this is one of the agenda with which this particular webinar has been organized. Oncology is definitely growing day by day, and how we can detect it early and solve it early is something we can help the whole patient fraternity in a very, very effective way. And this is a particular forum where all the doctors are present, and the first set of a responsibility actually lies on all of you. And this was the initiative to ensure that how we can detect it, how we can treat it, how we can take the helps. And I'm also going to share with you today that if you need any help in treating the identifying, having any confusion for the treatment of a cancer, then what you can be doing and what you should be doing. Friends, how many of you, is it fine if I make it a bit interactive session, Pankaj?
Yes, sir. Please go ahead.
So how many of you docs would like to have a situation whereby at one hand we are serving the society because we are those pillars of the society whereby we can influence the humanity the most, but at the same time healthcare needs some financial support as well so that we can uplift the whole healthcare ecosystem. Does it sound good to you guys? Can I have some responses in chat box to see that I'm resonating with you guys? Can we create a situation? I'm repeating my question. Do we want to create a situation, or do you want to create a situation where you're doing the social services and are able to make some money out of it also? Only one. I guess nobody wants to know that how to make money from a. Okay. So in that case, what we will do, we'll not discuss about how to make the money. We will discuss more how to make the society a wonderful place to live with and how you can treat. Is that fair enough?
Hello, sorry. Can I note something? Hello?
Yeah.
Yeah, sorry, my name is Adnaka Chinwafo. At the chat box, I think there's some restriction on the chat box. For example, I cannot share message to everyone. It's only the host I can actually send message to. So that must be the reason why you did not get responses when you were asking your question.
The organizers, can you help me out to see the messages that will help me, because I really don't want to discuss something which is not of a area of interest for my friends here, because everybody's time is really very important. So thanks for clarifying this, and so let me move ahead. So I am assuming that you guys are definitely interested. So there are, guys, before I start, let me share with you. Can I share my screen here? Can somebody give a feedback? Is my screen visible?
Yes.
Yes. Okay. Before I start going into those areas, I guess it's very important that you should know a bit what is MedicoExpert and how it is acting to create a perfect win-win situation between the patient fraternity and the doctor fraternity. And we guys are typically are the guys who bridge them and create a win-win situation. When I say win-win situation, it has to be a win for the doctor as well. We believe that doctors are doing a very good for the society, and they do have the right to make money sufficient enough whereby they can live very decent and life, can grow in their financial terms as well, along with doing the services. And from a patient perspective, we also play a very important responsibility whereby they are able to get the guidance and going to in the hands of the doctors where they can get a very good treatment. So, and particularly if I need to talk about our presence of our activities, what we are doing, we are actually today present in 17 countries, and with one of the offering whereby we are either working with the doctor fraternity, or with the patients, and very actively working in 17 countries. And there are 1,500 doctors and 300 network hospitals whereby we are continuously working.
Hello, Shala.
Yes, please. If somebody wants to, shall I go ahead or shall I wait?
Sir, please go ahead.
Okay. So the way we do work is, and in particularly in Nigeria, we have done quite a lot of surgeries. We don't believe in that for everything you need to, the Nigerians need to travel. We have organized certain camps. We are very actively working to provide the online consultations, a video consultation. For example, today we have heard Dr. Kate. I'm sure you might not be having any doubts what is the kind of a wonder she can do for the onco patient. And particularly in oncology, the days are gone where one doctor used to take a call. It is now becoming a teamwork. She emphasized the significance of a tumor board, which is a team comprised of the surgical oncologist, radio oncologist, and the medical oncologist. If any of your patient, you are a bit confused at what should be the right way, your patient sitting there in Nigeria along with you, and you can have Dr. Kate consulting along with you and showing the right way. And if she feels it's the other tumor board needs to be involved, that is also possible while you are there and doc sitting here. So this goes is a part of it so that we can identify what is the stage, what could be the right treatment plan. Since the treatment plan is based on the stages, it's very important that we are able to do it, diagnose it comprehensively. So medical experts can empower you, all the docs who are in this particular forum, to get connected definitely with the ecosystems, oncology ecosystems. So today we heard the medical oncologist, and the same center is having varied skills of the professionals who can treat any level of complexities, right from a bone marrow transplant to the robotic surgeries. It's very well equipped. So you do have the access today to serve your patients well, help them well, to identify the oncology cases early, diagnose it early, and ensure if they are treatable there, they are treatable there. We would love to treat them there itself. And if there are certain complexities or cases which can't be treated there, definitely there are other options as well, which we can work it out. I was also talking about the money part. So if you are organizing this consultations, which you can call it as video consultation, assisted consultation, second opinions, tumor board opinions, yes, they are going to be chargeable, and you will also be benefited from those opinions. And one of the things, since we worked in Nigeria quite a lot, so I can very confidently say that, particularly, okay, this is some actual figures, and you might be able to see me also in Nigeria, where we have done quite a lot of activities. So coming back, okay, how you can be benefited both socially and financially. So online consultation that can be arranged, where patient would be sitting, and you will not have any fear that the patient will move away from you. Patient will remain your patient. In front of you, you can organize the call consultation with the Dr. Kate, which you have met today, and the equivalents of them. And you can, what is that you are serving for the patient? A right opinion, right consultation, best expertise, best infrastructure support, everything. And that too, when the patient is sitting along with you in your consultation room, with the help of devices and technology, the way we are doing today. And we are saving his money just for a consultation. He doesn't need to travel. The tumor board can be accessible. So since we are going to save so much of our money for a patient, yes, we can charge. You can charge. And there are business models which Pankaj and Mainstay will be in touch with you, how you can make it further. So this becomes an online consultations. The second opinions also we have discussed are the complex cases where the whole tumor board is required. Those when the team of the doctors is going to be available, definitely going to be charged bit more. Then if they are treatable there, absolutely not an issue. But if there are any complexities, you be assured that your patients, and if they need to come to India for the treatment, they are going to be in the best possible hands, and the rates are going to be also very, 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 very comparative or economical in nature. And how do we achieve that? For example, today you have seen a facilities of a virtually or robotic surgery arrangement, state of the class DECA therapies are there, tomotherapies kind of a radio oncology techniques are there. And this is a hospital which is typically 2 hours away from the main city. If somebody is planning to come to the Mumbai kind of a thing, definitely the rates are exorbitant. It's like that if I'm going to be in Lagos or Abuja, the rates are going to be high. If I travel some 2 hours like Ibadan from a Lagos, the rates are economical. So this is how we have ensured that during this presentation, even if your patients need to travel, they are going to be in the best possible hands and they are going to be in the best possible rates. Okay. The next question comes, whatever I'm going to say that I'm a business guy also. So I'm going to give you hints and ideas how you can do both the social services and money making kind of a thing. So if modalities, again, I would say Pankaj and Mainstay will, you can get the details. I'm just here to throw some ideas. So when the patient is coming to here in India, you have two options, my dear friends. If you want some discounts to be passed on to the patient, your spirits are going to be very well respected. And your patients, and including the family members, why not the patients? For forbid say, I'm just taking an example. I really don't want any of your family member needs it. But if needs it, if you want somebody to pass on discounts, yes, we can pass on discounts. If you're looking for some referrals out of a good services which you are going to provide, yes, that can also be worked out. And the modalities and the details, definitely Pankaj and Mainstay can be in touch with you and work it out, how to do next steps with respect to this after the session. The next part also, it's not always to India. We are the guys, we are traveling Nigeria quite a lot. And we are doing surgeries there. The surgeries which are possible in Nigeria, we are actually doing it. So if I need to share with you, if you, for example, and we are bringing the latest technologies which are there, which are not so prevalent in Nigeria. For example, if I need to talk in a immediate future, so I guess we are going to be in, not a guess anymore. We are coming to Nigeria on 27th August to 3rd September for a surgical camps, where we would be present in Lagos from 27th to 30th of August and Port Harcourt 31st to August to 3rd of September. And guys, what we are going to do and perform here? So we are coming this time with the laser surgeries. I at least don't need to tell you the pains a patient need to undergo in a conventional modes of treatments for piles, fissures, fistula, and we are going to be solving it with a laser solution. Almost bloodless procedures we will be doing during these days. I'm sure if the Nigerian patients are able to avail these surgeries within Nigeria, what a better situation can that be for them? What is in it for you? Yes, I will come to that a bit later. Let me first share what we are going to do. We are also doing the orthopedic surgeries there. So which means total knee replacements, hip replacements, fractures and all such kind of things. Our focus is not so on fractures because you guys are able to handle it, manage. Our understanding is we want to play where we are able to bring the skills and upgrade the skills and provide a solution in Nigeria for high level solutions. And besides that, we would be focusing on that. This time we are not doing the arthroscopic surgeries. Otherwise we also do it, but this time the focus is this one. Then we are also doing the laparoscopic, would be doing the laparoscopic surgeries, the general surgeries, hernias, gallbladders, rectal polyps, any and everything in a laparoscopic way. Open general surgeries, you guys are good enough. If you need any support, we'll help you out. But if you are looking for some laparoscopic, minimal invasive options for your patients, yes, you can provide them in Nigeria, Lagos and Port Harcourt. Just 10 days, 10, 15 days down the line. Then we would also be doing the laparoscopic surgeries, gynec laparoscopic surgeries. Fibroid is a big problem in Nigeria, right? So we are doing and we have done hundreds of laparoscopic fibroid surgeries there and able to give very good results. So far, it's not it's our credit, but it's the God grace as well, and the skills of the doctors and support of the Nigerian doctors and the hospitals. We are having 100% success rate in all the surgeries. Where we would be doing, these are the 3 hospitals, Genesis and Hospital in Lagos, Outreach Hospital in Lagos, and Meridian Hospital in Port Harcourt. So guys, these are going to be a thing. One thing I missed it again. What is in it for you if you want to send your patients? So let me first stop sharing it. We can discuss and thereafter. Again, 2 options. If you want some discount to be passed on to your patients, we will respect your script. And that will be done. But at the same time, if you want some referrals for the service and opportunity you are providing for your patient, yes, that's also going to be respected very well. So guys, I tried to list out 3-4 ways in this particular session. Perhaps in next section, I will also share a few more ways whereby you can club the social services and the financial part in a very effective way and can help the society and can help yourself as well. So I'm now coming back to the question and answer sessions. The reason why I emphasize the need that now you have a responsibility to serve at a first hand the oncology patients. Please feel free all the questions with Dr. Kate, and she would be more than happy to answer all of your questions. And in future also, if you need any second opinion, consultations, any confusions, the team is going to be available for you. Thank you, my dear friends. Thanks a lot. Over to you, Pankaj.
Thank you, Mr. Sharma, for introducing MedicoExperts. and the opportunities to work along with MedicoExperts for the doctor. Thanks a lot. Dr. Shruti Kate, can we please have you back on the presentation? Okay, I think there is some technical error.
So no problem, Pankaj. No problem,
Pankaj.
Pankaj.
2 minutes. Please give us 2 minutes and we will start with the session.
So
Sorry
in
for
the meantime, Pankaj, in the meantime, if there are any questions audiences are having from me, I would love to answer them till the point Dr. Kate is coming back.
the questions.
If our friends are having any questions on a business part of it and looking any support on that, I can take those questions in the meantime.
Okay, so I received one question from Dr. Guagua. He is from Kano. Dr. Guagua could not post his question in the chatting box, but he sent me a WhatsApp. So he is stating like he has some patients who need treatment on the knee and hip replacements. Okay. So how is it that he can send the patients to, I mean, how is it that he can share the reports with us and which centers that he can send the patients to?
So typically the way we work is all the team of doctors are going to be available both in a Lagos and a Port Harcourt. Till the point the slots are available, we respect the preferences of the patient and your preferences if you want to send them. And if the slots at, let's say Lagos slots are closed, because we would be doing around, if I need to talk about ortho surgeries, we will be doing around 20 surgeries. We are having 20 to 30 surgeries we would be doing. And already the 17 surgeries are already booked. As per my opinion, today you can send the patient or recommend the patient either for a Port Harcourt or a Lagos. So that's perfectly an option. As far as how to send the reports and how to take the opinions, Pankaj is here. You can send it to the Pankaj or you can send it to the Mainstay team, either of that. And the treatment, what is that? Is it feasible? I would also like to share that. The surgeries which require typically 2 stages, such as the revision surgeries and all kind of a thing, where the first implant has to be removed and after some time a second stage of surgery is required. We typically are not able to take those surgeries. The basic TKR and THR, yes, we are handling very, very, very swiftly. And last 8 years, again, some 300, 400 TKR, THS we have done. And absolutely the comfort level. Next day, we are able to stand the patient with the new knees. So you can be in touch with Pankaj for the reports, and you can choose. Today, you do have an option to choose either the Port Harcourt or Lagos.
Okay. Sir, there is another question from Dr. Juliet. She is from Abuja. She would like to have a consulting center with the help of medical experts. So how can we go about it?
So again, shall I go ahead or somebody?
Yes, sir. Please go ahead.
So typically, again, there is nothing much required to create a consultation center from your side. A basic bare minimum infrastructure whereby you are having a sufficient video consultation. If you are going to participate along with the consultation, definitely you would be there to explain the condition, the history, and the challenges. If we require some vitals at that point of time, you would be able to assist that. So a basic infrastructure where you need to have a laptops, a good system, a decent system, in a room, a better lighting and a sound ecosystem, and the rest of the commercial modalities you can be in touch with the Pankaj and he would be able to share that. So how we can charge and how we can share the revenues. Essentially, if you want to know the thumb rule, I can share it here. We believe in win-win situation. If the revenue is getting generated at your end, yes, MedicoExperts would be definitely the doctor who is providing the second opinion would also be making having some share of it. You would also be having some share of it, and it's very well feasible. And Pankaj will guide you to the next steps of that. Or you can also choose to be in touch with the Mainstay team. They can also guide you how to move forward. But that is very well feasible, and it's really very good way. I seriously appreciate your move.
Okay. Sir, we have Dr. Shruti. Dr. Shruti, you are there?
Yeah, repeat it, please.
Dr. Shruti, are you there? Can you hear me?
Yes, I'm there. So I read two questions that were there in the chat box. One was that there can a hormonal contraceptive. Am I audible?
Yes, you are audible, ma'am.
Yes. So can hormonal contraception cause cancer? So yes, hormonal contraception can cause breast cancer, which is the hormone positive subtype. It actually, hormonal contraception, it prevents uterine and cervical cancer, but at the same time it can cause breast cancer, so that is a problem. But the incidence of breast cancer because of hormonal contraception is very less. More risky, I would say, is hormone replacement therapy, which is linked with both hormonal as well as uterine cancer. So whenever a patient requires, in the post-menopausal age group requires hormone replacement therapy, first thing is that you should assess what is the risk of developing breast cancer. For the patients who have high risk, we should not write hormone replacement therapy. Also, we should give the therapy for a very small duration of time. We should not give it for a longer duration because it will definitely increase the risk of cancer. The second question was whether P52 gene is associated with cancer. So, I think Paul wanted to ask about P53 gene. So, P52 gene is also there. It has been linked with cancer. But more notorious is the P53 gene, which is the tumor suppressor gene. So if this gene is mutated, it can cause cancer. It is the most common gene mutation that is associated with cancer.
Okay. Thank you, ma'am. Then besides these two questions on the chat box, then we have received some questions on WhatsApp. One question by Dr. Juliet again, Dr. Juliet Ogbodo from Abuja. She is asking, what are some early signs of cancer?
Sorry, I was not able to hear you. Can you repeat it?
Dr. Juliet has asked, what are some early signs of cancer?
Early signs of cancer.
Early signs of cancer.
Yes.
Yes. So early signs of cancer, it depends on which part of the body it has developed. So if it is in the breast, it can be a small lump in the breast. If it is any lymphoma, it will be a small swelling which can be palpated in the axilla or in the neck. Then it could also be due to, any difficulty in swallowing or any ulcer in the mouth or in the swelling in the tongue or something. So depending on what site it is, it depends on the organ, because the earliest sign of cancer will be development of some sort of a swelling, basically.
Okay. Then Juliet is asking another question on the same lines. Are there any chronic diseases that one should be careful of to be cancerous?
Chronic diseases which can lead to cancer?
Are there any chronic diseases that one should be careful to be cancerous? Like, is there any chronic disease that can turn into a cancer?
So,
Yes.
Yes. So basically, long-standing diabetes and hypertension can cause fatty liver. It can cause NASH. It is called non-hepatitis. It is a sort of a fatty deposition in the liver, and this is now becoming the most common cancer, the most common type of liver cancer. So hepatocellular cancer can develop in patients who have long-standing diabetes and hypertension. So unfortunately, we cannot do anything to prevent that, but we should all take precautions that we at least keep our chronic diseases in control. Again, in HIV, if the immunity of the person remains fine or the CD4 count remains above 200, then the likelihood of developing secondary cancers due to HIV is also less. So it is important to take timely treatment for these diseases, especially HIV, hepatitis B, and also diabetes and hypertension.
Okay, thank you. Then there is Dr. Adamu from Kano. He is asking, I have no cancer specialist in almost 100 kilometers of radius where I practice. The patients approach us for all their medical needs. How can I reliably be of help to my patients in the cases of early detections?
Your voice was breaking a lot.
Apologies. Can you hear me now?
I can hear you, yes.
Okay. So there is this doctor who is saying that he is the only doctor in in the area that he lives in, and how can he reliably be of help to the patients in the cases of early detection of cancer?
So, see, I can understand that she has very limited resources, but at least,
Yes.
she can arrange, once or twice education camps in her place where she can teach the women in her society to do breast self-examination. She can also, educate the people there about the early signs and symptoms of cancer. They should not ignore certain red flag signs and symptoms of cancer. She can use that to educate the people around her so that if there is any problem, they can immediately come to her. And easiest is to teach the women about breast cancer because that is the most common cancer now in women.
Okay, that was a really nice answer. Then Dr. Peter from Lagos, he has a question. Blood in stool and blood in cough, do they indicate cancer?
Yes, it definitely can be due to cancer. I will not say that it is always cancer. Blood in cough can be due to sometimes infection, but the likelihood of it being cancer is also there. Blood in stools can be due to very simple diseases like piles or hemorrhoids, but it can also be due to the cancer of the large intestine. So whenever there is a bleeding from either in the cough or in the stool, it is important that we do certain basic tests. So the basic test includes a chest X-ray for the bleeding in the cough, and if there is a bleeding in the stool, at examination should be done to see if there are any piles, and per rectal examination should be done if there is any palpable growth in the rectum. If you are not able to identify any palpable growth or very significant hemorrhoids, then you should at least suggest a colonoscopy to the patient, because that will be able to pick up any abnormal cancer lesion there. So it is not required for patients who have clear-cut hemorrhoids, but if you see that there are no visible hemorrhoids and still patient is having bleeding, then you should definitely advise sigmoidoscopy and colonoscopy for that patient, and a chest X-ray and a CT scan of the chest if there is bleeding from the cough.
Okay. Now there are only last two questions. I guess this is it that we have. Now there is one question from Dr. Omokoro Batukore. Is it true that cancer generally develops among people in poor health?
Sorry, could you please repeat? Cancer usually
I will repeat the question. Is it true that cancer generally develops among people in poor health? The people who do not take care of their health, they are obese, they do not have good diet.
So it is not very easy to take care of your health, I will say that. But I will definitely say that cancer is diagnosed late for people who, ignore the signs and symptoms of cancer or are reluctant to go to the doctor. I see such patients every day in my OPD where the patients have symptoms for many, many months and they do not go to the doctor due to the fear of, diagnosis of cancer. But I want to tell you, my friends, that you all understand that, and it is our duty to educate our patients that it is not the doctor who is giving you the disease. Doctor is only diagnosing the disease. So if you come to a doctor early and the diagnosis of cancer is done early, then you will have a higher chance of, defeating that cancer and living longer. So taking care of our health is very important, but it may not be, you cannot be a judge of what is taking care of health nicely and not nicely. But I would say that ignoring any symptom is very dangerous. As doctors, we should not do that with ourselves also, and as messengers of the health of the society, we should educate our patients also.
Thank you, doctor. And the last question is from Dr. Maxim Datasek. He is asking, have you come across a case where symptoms of the patient would be confused with another disease, but it was a cancer?
Yes. So I have come across many such patients where it was, it has been confused with infections like tuberculosis, and it turned out to be lung cancer. It was confused with hemorrhoids, and it turned out to be, rectal cancer. It was considered to be, again, tuberculosis, and it turned out to be lymphoma. Sometimes it is considered as swelling due to an injury, and it turns out to be a bone cancer in small children. So there are many times when a diagnosis is delayed because, we sometimes either hurry in labeling the patient, or I would say sometimes it is also important to follow the patient. Suppose we think that it is an infection. If the patient is not improving, it is important to go on and do another test to confirm whether we are on the right track. So it is also important to follow the patient up very closely.
Thank you. Thank you. And that was the last question. Thank you, friends in the audience, for your active participation. And thank you, Dr. Shruti Kate, for answering all the questions very patiently. We sincerely hope Dr. Kate could answer the questions. In case, if you still have any further doubts, you are requested to get in touch with us. I have left my number in the chat box. You also have the representatives of Mainstay, Healthcare Development Foundations. You can also ask them questions and they will convey it to us on your behalf. Thank you all for your time and patience. You have been a great audience. Take very good care of yourself, and we look forward to hearing from you soon. Thank you. Namaste.
Yeah. Thank you, everyone. And if there are any more queries or anything that you require from my side, please let us know. I'm extremely obliged to you, Pankaj, and your team for organizing this meeting and giving us the opportunity to interact with this very intelligent group of doctors. Thank you.
Thank you, Dr. Kate. Thank you all.